Good evening, everyone. This is Dennis Wong coming from Winnipeg. Tonight I wanna talk a bit about LDN or low dose naltrexone. What is it and what it's supposed to do? Naltrexone is a prescription medication. If you use it in full dose, 50 milligram to 100 milligram, it's actually treat narcotic overdose. However, there are case report and small studies that published over the year that if you use it in lower doses from 0.5 milligram all the way to 4.5 milligram, which we call it low dose naltrexone, we have to compound it because manufacturer products are only 50 or 100 milligram. And if you use it in those lower doses, this medication, prescription medication, actually reduce the inflammation and pain and also modulate the immune system. In turn, again, reduce the inflammation process. So it does it in a couple of different ways. One, in our system, something that our feel-good chemical or the pain response system that called endorphin system. Some of you may heard of it, some of you may know about it. When you use low dose naltrexone, hey Claudio, thanks for jumping on. When you use low dose naltrexone, what we do is that dose the medication at bedtime, and that actually block the endorphin production for about 6 hours. And so when you take it at bedtime, when you're sleeping, your endorphin level production get blocked, so it's reduce the endorphin. So by the morning when you wake up, your body then trying to push and increase the endorphin production. And so that when you have a higher endorphin, you feel good, you have less pain, you have less inflammation, and your immune system actually calm down with the higher endorphin production. So with that, a lot of people has been using it in conditions like fibromyalgia, chronic fatigue, etc. And then later on, we found out that actually there is another pathway that low-dose naltrexone actually work on in modulating or calming down the inflammatory pathway. In our body, the immune cell called macrophages, they have another cell called microglia cell that attach to them. During the normal time, those microglia cells are inactive or in the calm stage. When there is injury, foreign substance, immune attack, all of those happen, and stress also will activate the microglia cell. And when microglia cells get activated, then these cells create the whole immune chemical production, all the cytokines, TNF alpha, all of that, and then you get that chemical distribution that cause inflammation, immune attack happen. So when you take low-dose naltrexone, what we're finding is that low-dose naltrexone actually block the activation of the microglia cell. So for people with autoimmune disease or overreactive immune system and inflammation causing a lot of pain and inflammation, for those patients, if you use low-dose naltrexone, it may help calming the immune system from overreacting. So there's people in in North America that are using low-dose naltrexone for some autoimmune disorder, fibromyalgia again. So if you want to know more detail of what health condition or autoimmune condition that low-dose naltrexone may help, definitely PM me. I would love to share that with you. And you want to know how to dose it, etc. You want to talk to your family physician, and if they have any question, tell them to contact our pharmacy and we can help them out and guide them too, because we've been compounding this for a few years and we have a few different physicians that are prescribing in Winnipeg, and we're seeing some pretty good results. So I hope this is helpful information, and this is, another one of the armor that you can have in your treatment with certain health conditions. So this is Dennis Wong coming from Winnipeg, and I'm grateful to serve.